Next up is Keely Phillips. She's the manager of self-help and peer support and for the Center of Excellence in Peer Support at CMHA in Wellington, or Waterloo Wellington. It's out by where I live. I'm from Brantford, so yeah. The Center for Excellence works to strengthen the presence and practice of peer support throughout Waterloo Wellington. Keely has worked as a peer worker in a variety of settings and holds a Master's of Social Work. So please put your hands together for Keely. Thanks a lot.
Don't move.
Okay, I'll just stand still and not move. That's really hard for me. Awesome. Okay, so hi, good morning, everybody. So I'm gonna start by talking a little bit about me and why I work in peer support, what brought me to working in peer support, and a little bit about my experiences in it, and then I'm gonna tell you about the work that I do and some of the highlights or some of the things that I think is really cool about both the self-help services, the direct service that we provide in Waterloo Wellington, as well as the work that our Center for Excellence does. And you'll notice that there's some themes that are a little bit similar with the work that the Center for Innovation and Peer Support is doing in Enlighten as well. So, okay. Still good.
They're cutting off. But it's fine.
So I didn't have access to formalized peer support when I went through the mental health system. I didn't even know what peer support was until somebody sent me a job posting 10 years ago, and they were like, you'd be a really good peer support worker. And I went, I don't know what that is. But I looked it up and I did some learning around it, and I was like, oh, I might be good at that. That might be a fit for me. When I went through the mental health system, I felt really alone and really isolated. I was 21, I had to drop out of school. I had to move back to a small, I grew up in Eastern Ontario, and so I had to move back to like this small little rural town that I hated, and I moved really far away from that town. I was in and out of hospital for a bit, and eventually I got into a depression treatment program, and the first day I walked into that depression treatment program, I walked into like a lounge area, and it was full of folks that were going through the same stuff I was going through. They were the same age as me. They also had to drop out of school. They were also worried about how their parents were dealing with the stress of them being in and out of hospital. And that was my first experience with peer support. And it felt like half of my illness disappeared, because I think half of my illness was the isolation and the stigma and the shame that I was carrying. And so the funny thing is that I didn't expect this to be my career. I was going to be a teacher, and that was going to be my thing. I didn't expect to work in the mental health system. I didn't really know that the mental health system was a thing until I went through it, and then I got angry at the system. And so when I started to work in peer support, originally the organization that I worked for was called Self-Help Alliance, and we were sort of at arm's reach from the local CMHA, and I was a peer support worker at our Cambridge site. And over the years, the organization has shifted and changed and is now an integrated part of CMHA Waterloo Wellington. So peer support and self-help, and I've had several different roles within Self-Help Alliance / peer support and self-help. So I started as a facilitator at our Cambridge site, which was a walk-in recovery center where we run groups and offer one-to-one peer support. So I started there, and then I went and did a pilot being a peer worker in an emergency department and on an inpatient unit at a local hospital. And that was really, really hard. That was hard because we didn't know at that point all of the challenges that come up when we put peer workers in clinical settings. My boss was like, oh, you're gonna, like, there's gonna be some stigma, and they might be mean to you. And I'm like, whatever, I'm tough. I'm not actually that tough. But I wouldn't go back to it. I wouldn't go back to that job, but I guess I liked it enough that I convinced one of my best friends to go do it. It's very valuable work, and she is tougher than me. But yeah, we didn't know things like it's really important to train the team that a peer worker is going to be working with around understanding what peer support is. We didn't know what looking for internal champions of peer support looked like. We didn't know about peer drift and how peer workers might drift into the clinical. We found all that out through our experience of me being, as my supervisor at the time said, he said I was walking around with a target on my back. And it felt like that a lot of the time. After that, I went and did some recovery education work, and I also got to work with a program called Skills for Safer Living, which is a 20-week suicide intervention program for people who've attempted suicide. And it's peer-led. It's led by people who have that lived experience. So I got to do that. I went back to school. I did my master's because I was like, I'm going to be done working in peer support because I knew I wanted to work in management. I didn't see a future. There's very few management roles in peer support. We need more of them. And sort of through a very convoluted way, I ended up in my job now, managing the program. But in the meantime, I also did some research and evaluation on peer support. I actually realized in my master's that as much as I was trying to move away from doing peer support work, all my projects were on that. So clearly something about this work is where my passion lies. So Self-Help and Peer Support is a peer-led department of CMHA Waterloo Wellington. We have 3 walk-in centers, recovery centers in Cambridge, Kitchener, and Guelph. And the program is grounded in the learning that people find on their recovery journey. So programming it's led by our participants. Our participants come in and they say, hey, I'd love to have a group on this. And we say, okay, we'll help you start that group. Not just we'll run a group for you on that. We will help you gain the skills and capacities to lead that group yourself. On average, this is a little bit of a map of our services. On average, we have 50 folks a day who access our services. We offer an average of 8 different groups a day. And we have about 50 engaged volunteers at any given time. 90% of our programming is volunteer run. We also have, as Barb mentioned, I think it was Barb that mentioned the diversity of peer roles that can exist within a system. So it's not just about people providing direct peer support via groups or one-to-one peer support, but we also have an advocacy coordinator who helps people learn self-advocacy skills as they navigate sometimes the discrimination and stigma that folks are experiencing as they move through the addictions and mental health systems. We have an entrepreneurship program that helps folks who want to start or grow their independent business. And so he'll work with folks on, and he works with any sort of self-employment. So he'll work with folks on grant applications and business plans and a lot of stuff. He's a super knowledgeable guy. We have an expressive arts program called Spark of Brilliance, and then recently we brought into our service, under our service umbrella, a program called Beautiful Minds that brings folks with lived experience into high school classes and teaches about mental health promotion, and high school students get to hear somebody's recovery journey. And then we have our Center for Excellence in Peer Support, which is, we have in total, we have over 40 peer workers in our local system, but we don't necessarily work with all of them in the work that I do. Our Center for Excellence in Peer Support is fee for service, which means that we have not received any government funding or any funding to do the Center for Excellence in Peer Support work. So community organizations come to me and they say, can you support and train my peer worker? And I say, yep, but you're gonna have to pay for it, which is an awkward thing to say. I'm getting a little bit better at it. So internally, I have 13 peer staff. We also have an additional 11 peer staff that we support externally, so hospital peer workers working in housing. I'm going to talk about our Conestoga College partnership because that's a really cool new program we've got going. And then we also have 14 other internal CMHA peer workers. So peer workers who don't necessarily work in the peer service side of our CMHA, but they might work on integrated teams, such as an early psychosis intervention team. We also have a peer warm line, stuff like that. This is impossible to read. There's no way anybody could possibly read this. And I mean, the slides are a little small anyway, so I didn't put this up there to show you for you to be able to read it, except maybe you can read the title, and it says Recovery Outcomes of People Accessing Peer Support Services. We asked our folks for about 4 years. We had people accessing our services complete surveys every 6 months on how's your life different since you started accessing services. And folks found, and folks they also told us what they were working on, which was really, we thought that was really critical because it didn't really, like, I want everybody to be healthy and happy and well, but if you were doing all that work on maintaining healthy relationships with a therapist or a support coordinator, that didn't really tell me how my service helped you. So I wanted to know, what are you working on when you come through the doors of self-help services? And are you any better or any worse as a result of that? And so what we found was that overall, people are working on self-esteem, hope, coping skills, and improving their participation in meaningful activities, whatever that looks like for them. And what we found was that 80 to 90% of people, when they said they were working on something at our services, they were seeing really positive results in their life as a result of that. We also, through asking those questions, we also asked some other questions like, were people working on, reducing the symptoms of the mental health issue they experience, or reducing their substance use? And we didn't see ourselves as a concurrent service. We saw ourselves as a mental health service. And what we found out was that 40% of the folks walking through our doors were working on reducing substance use. So we were a concurrent service. We were an addiction and a mental health service. And we didn't know that until we asked. So through our Center for Excellence in Peer Support, we support peer workers. We have monthly community of practice meetings. We have smaller team meetings. What we've learned is that addiction peer workers often deal with different types of stigma and discrimination. They deal with the what they deal with in their roles is also helping people navigate the criminalization of drug use. And so we bring our addictions peer workers together for smaller separate team meetings in addition to our community of practice meetings. We also do that with our hospital peer workers as well, because working in a hospital environment is a highly, highly, highly clinical environment. And those peer workers just need a little bit of extra support around working in that environment. We do an annual retreat with our folks, and we provide them ongoing training and educational opportunities. One of the big things that we've done research-wise is we've looked at how do you implement peer support roles in mainstream settings, particularly in clinical settings. And what we found was that we identified some common role implementation issues that peer workers experience. And we created a set of reflective practice questions for agencies, their supervisors, peer workers, non-peer colleagues, to address and or prevent some of the common issues that come up when we do things like put a peer worker in a hospital setting. So this is a big chart of what those look like, but it's everything from the co-optation that can occur with a peer worker to how people are using their lived experience and how their colleagues understand what using lived experience looks like. And it's things like dealing with the isolation. It's sometimes, and this is when we implement peer roles, what we often see is the pattern of people don't understand what it is, and so it's underutilized, and the peer worker gets really, really, really bored because nobody's accessing the peer worker. And then suddenly something clicks, and people really get it, and they get it, and they get it, and they get it, and the peer worker becomes overworked. So they start out being underworked, and then they become overworked very quickly. And we just had that happen with our peer support warm line at CMHA. Nobody got it, nobody knew what it was for, and so these two guys are like, oh, I'm so bored, nothing to do today. And then last week they emailed me and they said, yeah, I know we're not supposed to have a wait list for our service, but the two of us are supporting 80 folks right now. And so we gotta figure out something, because that's a lot of work, supporting 80 folks. So we're also working on creating a supervising peer workers toolkit, which is looking at how do we help organizations just better plan and implement peer roles without giving away all of our peer expertise, right? I still want organizations to need to seek out experts in peer support, particularly through consumer survivor initiatives. So we're not going to give away all of our expertise, but just getting organizations on the right path to understanding what are some considerations when you implement a peer support role. So that includes things like understanding why effective supervision matters, which some of it is not even unique to peer work. Some of it is just, things like what effective supervision looks like in healthcare. I have a lot of peer workers who've never gotten a performance review, and they've been in their roles for 10 years, but their organization just doesn't do any evaluation of their staff. And that's just poor supervision then. It's not about peer work or not peer work. So we talk about what good supervision looks like, how to carefully implement a role, and then the idea, and talk about what peer support is, and just get that understanding of peer support. If we can just get everybody supervising peer workers who hasn't been a peer worker, regardless of whether or not they have lived experience, because this is sometimes a challenging thing. Sometimes supervisors will say, well, I have lived experience, so it's okay, I got this. And I'm like, but you haven't been a peer worker, right? So it's different. And so we talk about just a baseline understanding of what peer support is. And organizations looking at how do they know if they're ready for a peer worker? Are there policies that are going to discriminate against the peer worker or not allow the peer worker to be able to do their job properly? When we used to have peer workers start, and this happened both within my CMHA and I've seen it happen in other places where they say, oh, but the peer worker can't access the clinical file on the client. I'm like, well, but everyone else on the team can. No, the peer worker, they don't need that. Well, but so then you're asking the peer worker to have no knowledge of the person they're supporting, no knowledge of the approach that the team is taking. They're like, well, it's all clinical stuff. I'm like, the peer worker still needs to know that. They're not going to use it, but they need to have access to it. Because otherwise you're setting them up for failure in their roles. So we look at how to welcome peer workers to a team. What a successful how will you know when you have a successful peer worker? And then one of the biggest issues that comes up in peer work is role clarity. So how do you know what's within the scope of what peer work should do? Christina talked about her values in action document that they've created. That is probably the most useful document I've seen come out in the field of peer support in a long, long time, because it really actually articulates the scope of practice of peer support. And we're also looking at some reflexive practice guidelines for peer workers to help them understand things like, if you're working in a hospital setting, and you're experiencing microaggressions in your workplace, how do you recognize and deal with that? What's the internal process? How do you understand who you are and the role that you play, who you are in the context of, your own self and, what you carry with you in terms of your lived experiences, and then the context around you. Because often what we see is folks who are engaged in peer work, and I know that and this is me drawing from my own lived experience, I thought that hospitals were terrible, oppressive systems, and so I don't know why they ever let me go work in one, because I pissed off a lot of folks. Because what happened was I carried that with me into my workplace, into working in a hospital, and I didn't have the awareness of, wait a minute, maybe I shouldn't be looking at the hospital only as an oppressor if I'm working in the hospital, because that's going to impact my ability to connect with people. It's going to impact my ability to have relationships with my colleagues. And so I had to do a lot of work around reframing and understanding how hospitals do, in fact, help people. And so, it's all been a learning for me that now I bring into how I support peer workers as well. And so this is sort of one of the things that we do is we ask peer workers to look at, this is called the Flower of Power exercise. It's looking at what are the areas in your life in which you have privilege and which you don't have privilege. And recognizing that every peer worker is going to be different. Some common themes for peer workers are that peer workers, have that lived experience of a mental health or addiction issue, which means that they've at some point in their life experienced disability. So they're not necessarily able-bodied. They would be in the less powerful situation of being disabled. Education is often a big one. Not just because of whether or not a peer worker has education, but because in the mainstream mental health and addiction system, what we tend to value is educational expertise over lived experience expertise. And so peer workers comes in, and that's disruptive when we say, guess what? Lived experience expertise is just as valuable. Can you value it just as much as your professionalized educational expertise? And then we talk about sites of practice, right? So if you're working in a mainstream mental health setting versus in a small consumer survivor initiative, and I've worked in both of those, what I found is that the legitimacy of, oh, I work for CMHA is very different from I work for a consumer survivor initiative, right? And so there's a power imbalance in that as well. So we help peer workers understand all of that and how that plays into how they're doing their jobs and how that impacts their sense of self. So my last slide is to talk about this really cool partnership we have going with Conestoga College in Kitchener. And I'm really lucky in that I live in a wonderful neighborhood. And I got to know my next door neighbor. And it turned out that she was the director of student success at Conestoga College, which is the counseling services, medical services, and the accessibility office at Conestoga College. And I said to her, oh, have you thought about bringing peer support to campus? And she went, yeah, I'd love to do that. And I went, I can help. And she came back to me about 6 months later and she said, I have funding to put a peer worker on campus. Can I buy a peer worker from you? So now we have, and the space is opening officially on Monday. And it's been sort of softly launched before, but we actually have a peer support space on Conestoga College campus for students to walk in. There's going to be at least one group a day that students can attend. There'll be some individualized peer support. We're going to recruit student volunteers to deliver a lot of the content of the groups, to provide some one-to-one peer support. And so the great thing is not only are we bringing peer support to campus, which is certainly a thing that I could have really benefited from, might have prevented me from dropping out of school, but not only are we giving students that support on campus, but those folks are going to graduate and they're going to need jobs. And I'm always looking for trained peer workers to hire. So part of it's it's a workplace development strategy for me as well. So, but it's really cool because we think it's the first of its kind in Ontario. We've seen some other models of peer support on campus, but this is the first time where we've seen a peer worker, a mental health and addictions peer worker placed on campus specifically to deliver this type of support. And so the Center for Innovation in Campus Mental Health is regularly connecting me with other campuses and stuff like that to talk about this cool pilot, which is just up and running, and so we don't have any outcomes from it yet, but we're really hopeful that it's going to be pretty amazing. So that is a snapshot of the work that I do at CMHA Waterloo Wellington and the work of our self-help services and Center for Innovation and Peer Support. So I'm going to turn it back over to Richard because I think we're going to have some questions.
Thanks a lot, Keely. I think we're really fortunate to have these three individuals here who are really innovating peer support across the province.